everyone. I'm Erin Burnett, and out front tonight, party time. Both sides spinning the health care verdict, the president celebrating his individual mandate ruling at the Supreme Court.
Today, I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward.
And Republicans seeing a way to rally the base because, after all, this is now a fight for the underdog. They see it as, hey, the Supreme Court failed to repeal what Republicans see as a hated health care act, a big overreach of big government. But if you elect Mitt Romney, he is going to slay the health care dragon.
What the court did not do on its last day in session, I will do on my first day if elected president of the United States.
Well, that was pretty loud and clear. Both sides were celebrating and partying it up like guys at a bachelor party. But the problem is, no one was a winner today. And soon they're going to wake up feeling pretty hungover. In fact, just like how the party ended in, well, the hangover.
You okay, buddy?
No, I am in so much pain right now.
Look at this place.
I know. Phil, they have my credit card downstairs. I'm so screwed.
Wait, how does a tiger get in the bathroom? It almost killed me.
Yeah, we just woke up with a tiger in America's bathroom. In all seriousness, the point is this: we're all losers. Why? Because even if you love what this health care bill does, things like covering pre-existing conditions, you have to hate what it does not do. Because it does not deal with surging health care costs in America. As we've been saying, in our country, where we spend the most on health care per person than any developed country on earth, we rank number 27 in life expectancy. So more people are covered thanks to the Supreme Court ruling, which may be a great thing. But under the so-called Affordable Health Care Act, healthcare analyst Dan Ripp of research firm Bradley Wood says premiums will rise 7.5% a year, 4 times more than the inflation rate. And the spending is getting worse. According to the Centers for Medicare and Medicaid Services, health spending in 2010 grew about 3.9% from the year before. But in 2014, when the president's health care law takes full effect, spending will jump 7.4%. That is a massive fail. Nick Gillespie is editor-in-chief of Reason TV and Reason.com. Ben Smith is BuzzFeed editor-in-chief. Roland Martin is political analyst here at CNN. And Erick Erickson is also the editor of RedState.com. Okay, great to have all of you with us. Ben, let me start with you. Obviously, quick to have victory laps going on both sides. Republicans are trying to say, oh, look, the Supreme Court gets you off Obama only because you're raising taxes on the middle class. Will that stick?
No, this isn't an issue Mitt Romney can fight and win. He passed a very similar law in Massachusetts. I think both he and the president are going to want to stop talking about this after the holiday weekend. I mean, the winner is John Roberts, who really set up the court and set up himself for this much increased stature. I think the political campaign is going to move away from this fast.
Eric, it may be that Roberts was the only real winner today.
Oh, I think Roberts was probably the only real winner today. But look, the Republicans are going to make the Democrats own this. And let's not forget that the big issue here isn't just going to be presidential races, but down ballot races in the House and the Senate, where the Democrats still have more seats at stake in the Senate, many of them in red states. Many of them don't like raising taxes, and you can bet the Republicans will make them want to vote again on the biggest health and tax increase in American
So you think
history.
this will motivate the Republican base more than a victory, which would have sort of, eliminated the big, hey, if I get in office, I'm going to repeal it argument?
Absolutely. Yeah. It has taken the Supreme Court off the table for the left. It's made it an issue for the right. Mitt Romney's raised $2 million before sunset today just on this issue.
That's right. And Roland, I think the latest number is $2.5 million from the Mitt Romney campaign. I just got an email here. The Obama administration is saying, say you're with me on affordable care. They're trying to raise money. Who do you think will benefit more when it comes to fundraising off of this? The winner, Barack Obama, or the seeming loser, Mitt Romney?
Look, I know we love to go right to the heart of the political issue. But again, I will say the very people out there, the millions of people who are now covered, the folks with pre-existing conditions, the folks who are sitting there, if you're a young person on your parents' health care. Let me tell you something, Erin. Look, I know how this feels, okay? 2000, covering the Democratic National Convention, my appendix ruptured. 5 days in a hospital in L.A., $100,000, no health insurance, had to file for bankruptcy, house almost foreclosed on. So I know what it feels like not to have health insurance. And so we can get caught up in the political arena, but the reality is we now have to deal with people who now can be protected. And so now how do you fortify this? How do you make it better? How do you bring down costs? This is a start. This is not the end. This is the beginning of a real discussion and a real national health care plan.
All right, Nick, the problem is, though, is this seems to fall in that category of it's great more people are covered, and you want that outcome, but this was done without dealing with the costs. We're looking at costs rising 4% in 2009, 7.4% under this law. Costs are going to rise more under this law than they were before.
Right, and if the past is prologue, the healthcare costs are going to be jacked up even more. The government, you know, whether it's state, local, or federal, already spends almost 50 cents out of every healthcare dollar, and prices have been going up astronomically, far above the rate of inflation. You bring the government even more into the matter, and the prices are only going to spiral up more. Then the government will say, well, we got to subsidize rates more, and then that'll jack it up the next time. I think the question for Roland to ask, and I say this, I'm not a Republican, I'm not a Democrat. My book, which is out in paperback, is the Declaration of Independence. I am an independent. Why would it cost $100,000 to fix your appendix? You know, it's partly because of the heavy subsidies and the government involvement already. And to go back to the Republicans, Mitt Romney's the last person you want to be arguing in a world where Obamacare has just passed constitutional muster. He has no plan to counter what was just done, you know, what he did at the state level, at the federal level. It's a real problem.
I mean, let's not sit here and we talk about costs going up as somehow it's only because of the Affordable Care Act. One of the reasons costs are going up in this country. No. I'm not saying you said it. What I'm saying is one of the reasons we're seeing rising health care as well is because our nation also is becoming more obese. We also don't want to confront when it comes to wellness. And so when you begin to deal with the issue of wellness, when you begin to have folks who have regular checkups, when you begin to have folks where you're able to catch something earlier as opposed to late in the game, then you're dealing with that. And so I say you have to deal with the cost. This is simply the beginning of a process.
Well, then you're getting to issues of saying, okay, look, well, you know what, if we're going to deal with obesity, that means people who weigh more will have to pay more. And that is something that just doesn't seem to have muster in this country.
One of the things we learned in the first round of this thing is that any attempt for the government to impose cost controls, I mean, death panels, so-called, were the outstanding instance of that. And I think the Obama administration backed off very fast. People just don't like the idea of the government saying, you know, this treatment is cheaper, and so we're only going to pay for that, right or wrong.
Right, Eric.
There were never death panels. So I mean, where's that even coming from? So, there were no death panels.
They were not in fact death panels. They were a small step in that direction.
To restrain the cost of health care. Yeah, they were imposed to restrain the cost of health care. Look, going forward, I get what Roland's saying, and when I hear Democratic pollsters say that people like individual pieces of health care, that's fine, but the Roberts decision means the Democrats are going to have to fight on the GOP turf on this, which is full repeal, and 60% of Americans in some of the worst polling on Obamacare, 60% of Americans still don't like the bill overall. They don't like tax increases, and we're going to go into November with the Democrats being forced to fight on this Republican battlefield. The Republicans may need a plan, but right now their best plan is just to say repeal.
And if you're a Democrat, Eric, you should go to those states with the worst health care, and when it comes to the folks in worst condition, Mississippi, Alabama, Louisiana, Arkansas, Texas, West Virginia. You want to talk about health care? Go to those states that are red states.
The real problem why health care costs are going up, and Roland is right, this was happening long before the Affordable Care Act was passed, but that's going to pour gas on the fire. It's because of increasing government involvement. We all know when the government becomes the main provider of something, costs go up because costs will never be accounted for properly. That's the big issue. You know, get the government out of health care and you'll start to see prices come down. Romney can't sell that, and the Republicans have had plenty of time to do it. The last time they controlled the federal government, what did they do? do? They gave us the prescription drug plan for Medicare, which is the most egregious handout to relatively wealthy seniors to get free or reduced price plans. This is why Americans are moving away from the Democrats and the Republicans, because you hear chatter. It's a red team, it's a blue team thing, and the American people, Erin, like you said at the beginning, the American people are the real losers because we're stuck with the bill, but we're not going to get the access to care that everybody seems to be after.
A Democrat or a Republican will be president.
Well, that is true. But of course, we want to eat what we want and drink what we want, and then we want to make sure we have care. We don't want to pay more for it. I mean, there is a big problem. By the way, there are specific reasons healthcare costs are surging in this country. We're going to talk about it more in just a couple.